Hello and welcome to the Mindset Mentor. I'm your host, Tania Kolar. I hope you're having an absolutely phenomenal day living your best life because the Mindset Mentor, this show is all about helping you to live your best life by strengthening and conditioning your mindset. And I always talk about how your mindset is a muscle. So that muscle needs to be strengthened and conditioned in order for you to really truly optimize your life. So this is your mindset workout for today. So, what we're going to talk about is chiropractic care and the connection between mind and body, and how, the body is always giving us some really great signals. Sometimes those are painful signals to let us know that we need to address, the emotional aspects of our lives to alleviate some of that pain that is going on in the body. So, we're going to delve deep into that. And in fact, there is an association between back pain and lack of support, whether that be emotional support or financial support. So it's really interesting. Stay tuned for this hour because I have my friend Nancy Korenic joining me today, who is an expert when it comes to back care and skeletal health. Her mission is to help us get healthy and certainly to stay healthy. Nancy is a chiropractic doctor, and she's also the owner of Korenic Chiropractic and Wellness Center, which is based in Mississauga. So she's going to teach us and help us to get healthy. So important to get healthy because, it's almost virtually impossible, or certainly feels impossible, to live your best authentic self in your best life when you're experiencing acute or chronic pain. That's not fun, right? So we're going to help you get healthy today. So let's say hello and welcome to Nancy Korenic. Nancy, it's such a pleasure to have you here on the Mindset Mentor.
Thank you. It's such an honor to be here. Thank you for having me, Tanya.
Oh, a pleasure. Well, I'm so excited to just delve into the conversation because so many people have experienced back pain, or right now in this moment are experiencing back pain or witnessing a loved one go through back pain. And it can truly be debilitating to the point where, you cannot function daily. So there's so many varying degrees of back pain. So I want to talk about first thing to really let everybody know what is chiropractic care, because I think there's a huge misnomer out there of what it is. People are fearful of it. And I think it's actually really a good idea, maybe later on in the show, to talk about some of the myths that are happening when it comes to chiropractic care. But let's spell it out for everybody. What is it?
Right. Well, thank you for the opportunity to share. So, chiropractic care is actually a natural health, an alternative health therapy that can get you to live your best life. What we do is we focus on the alignment of the spine. And what happens with that, I tell everybody, I'm like, we're known as back doctors, as chiropractors. And it's kind of true because we do work with the bones of the back. But Tanya, it's really mainly to affect and stimulate the nervous system, which is your brain, your spinal cord, and your nerves. That's your central nervous system, which controls everything in your entire body. It controls all your muscles, your cells, your tissues, all your organs. And we actually live our life through it. So it connects us to our physical reality. So obviously, as a chiropractor, pain is an issue because sadly, most people don't do anything about their health until they're broken. So I see a lot of people that come in and they are in pain. But my focus is really to create the alignment of the spine in an effort to reduce the stress on the brain and the nerve system so that those messages can get down through the nerve system to all parts of the body, and the body can heal and restore its healing ability. It can heal, it can regulate itself the way our designer designed us to.
Oh, I love that. That's awesome. Now, I mean, there's so much involved, of course, right through the entire body. But something that you said that I want to talk about and delve a little bit further is the ability to heal itself. So the body and the ability to heal. So how does chiropractic help us to actually heal our body? Because, oftentimes we take, let's say, a painkiller, trying to alleviate the pain, but that's actually just a temporary sort of a Band-Aid solution. solution, right? So when the body has the ability to heal, I mean, that's really truly what we want. So what can we do to get to that point?
Well, absolutely. And that's what we're looking at when we're dealing with chiropractic care. And chiropractic is based on that premise is that the body heals itself. And it does that through the brain and the nerve system. So when you have interference on your brain and nerve system, it cannot function, heal, and recreate itself the way it's designed. So, and stress in our life, and there is no shortage of stress in our lives, Tanya, and it comes at us from all different angles: physical, chemical, emotional stressors are constantly staining us and forcing us to adapt. And you know what? We are designed to adapt to these stressors until it's too much. Okay. We have layering of toxins, traumas, and thoughts that continuously layer on our system and stain it. And when it cannot adapt to these stressors, when our nervous system is overwhelmed by these stressors, Tanya, that's what happens when we subluxate. And it's a big fancy doctor word that chiropractors use. And all it means is that it creates stress on the nervous system, almost like an interference on the nervous system. And it basically blocks the body's ability, or interferes with the body's ability to heal itself and to recreate itself. So you asked how chiropractors can help us heal. Well, we look for these subluxations. We look for these interferences on the spinal cord and the nervous system, and we remove them. So we locate them, we remove them, and then we restore the connection between the brain and the body. Tanya, I tell everybody, I said, our body and our ability to heal itself, it depends on these connections. Okay. We don't work on Wi-Fi. These signals from the brain need to get there. They need to get through the nervous system. They need to have that clear connection. Otherwise, our body is moving towards illness and disease instead of health, wellness, and vitality.
Yeah, and we certainly want to address it before we get to the point of being broken, as you said before,
100%.
right? So, being proactive, I think, in our health is certainly key. You talked about interference. So that interference comes, obviously, I would say, right from our external environment as well as the internal environment. Our thoughts that we're thinking about, life and just stress. And so many people are operating in a perpetual state of overwhelm. So activating the sympathetic nervous system, right? And it's like that fight or flight mode kicks in, but it kicks in ways that are not life-threatening, right? Our body was meant to have that to protect us from those life-threatening situations, so we can make that decision. But when you're treating people that come into your practice to take care of their back health, do you find that that sympathetic nervous system has been activated in many people?
100%, Tanya. So our sympathetic nervous system, and I'm preaching to the choir here because I'm sure everybody knows this, but it's meant for fight and flight. It's meant for those short bursts of time when we're actually in danger. And it gives us the adrenals kick in, and it gives us that burst that we need to get away from whatever that danger signal is happening at that moment. But we are not meant to live in that state. And people have a real hard time grasping that concept, because we live in that sympathetic state. So it's a chronic state, and then we burn out our adrenal. It's like we're depleting our gas tanks. So we've got nothing left. We are not meant to live in that sympathetic state. And I forgot what my point was. Anyways, we are not meant to live in that sympathetic state, Tanya. So,
yeah.
And a lot of people are. And actually, what I tell people, this is what my point was a lot of people can't make the connection between emotions. They're like, Dr. Nancy, how does this affect? Like, how is my, anger, or how is my, hating my job? How is that affecting my back pain? Because when I'm working with people, we try and create momentum, and I'm always resetting the brain and the nerve system. And when we do that, the nerve system learns, and it starts to release those stuck patterns, which is amazing. And that's when people heal. But when they go into their life and they're not changing their strategies, or they're not changing those stressors, or they go back to those jobs or relationships that they hate, or they keep having those fights, I tell people, I'm like, think about yourself when you're angry, and you do the same. Like, think about somebody that's really making you angry, and you're just, flying off the handle. Maybe people don't, but
Yep.
people they tense up when they're angry, and their facial expression is, you can see the anger on people's face. If you get into that physiology, think about what that's doing. That's your nervous system doing that, and you can
Mm.
live in that. It gets stuck in that pattern. So it absolutely contributes and even causes these interferences and blockages and leads to pain and symptoms. And pain is really not the bad guy. Like I tell everybody,
Hmm.
pain is the way that the body's telling you that something needs to be addressed and that something's going on. You need some new strategies.
Yeah, and thank goodness that we're having this conversation to help people come up with some really great strategies that can help them. Because again, as we are going through that tense moment, as you say, we were sort of like really sort of tightening up. There is a chemical reaction happening in the body. I mean, it's scientifically proven. So it's really fascinating. And if we have the ability to control that, that's empowering. And I find that that's really hopeful, providing a lot of hope to people who have suffered, whether chronically or, acutely from any sort of aches and pains. It's really frustrating. And I think that frustration can lead and perpetuate more of the dis-ease in the body because it's what we're focusing on. It's really interesting too to see how the back is so connected with other areas of the body. And I'll give you an example. I mean, a personal example. This is perfect timing to have this conversation because I'm experiencing a pinched nerve. I just went
Oh,
to, yeah, I just went to the doctor the other day, and I was there for a physical because I just experienced, going through chemotherapy, through breast cancer, and just having a checkup, and I was like, wow, I have a pain in my leg, so it was pretty much from my knee to my thigh, and it was mostly when I sit down, and I thought, wow, this is actually really painful, so I mentioned it while I was there, and then the doctor asked some questions, had an exam, and she's like, oh, well, it's not your leg, it's your back. You have a pinched nerve in your back. And I thought, oh, I never would have put those two together, right? So we kind of tend to, I think, dismiss some of the signs in the body. I mean, I knew that I had back issues, some back pain for a little while, and I just thought, well, my body's still healing from chemotherapy, and I just assumed that, hey, this is normal. And I think a lot of people say that or believe that, oh, well, I wake up in the morning with all these aches and pains. It's part of aging. People always blame it on age. It's just aging. But really, Nancy, what are your thoughts on that? If we take care of the body, can we actually come to a point where we can wake up and not blame, age as being the culprit to all of our issues?
absolutely. And, I think, first of all, I didn't know that you were going through the breast cancer. So my
Hmm.
prayers and blessings to you
Thank
for,
you.
for strength and health and everything that you're going through.
Thank you.
As far as the aging, we all age, yes. And I hate that. I find it an excuse.
Yes.
We all age,
Mm-hmm.
yes.
Mm-hmm.
There is a deterioration process as we age, but we can age with our foot on the gas pedal, or we can take our foot off of the gas pedal and slow that process. And that's what I'm all about. Not to say that we want to, resist aging. No, it's part of us. It's
Mm-hmm.
beautiful. Let's embrace it. Let's accept it. But it doesn't have to be a deterioration process where we just use it as an excuse and allow for all these limitations to occur in our life. I'm all about living my best life, and I
Mm-hmm.
encourage people to do the same. And let's find ways to defy that in a sense, but embrace it, but also defy it and slow that process down. So,
Yeah, that's beautiful because I think that people do have a tendency sometimes to give up, and because it's frustrating. It's so hard to go through a physical pain in the body that, of course, is also equated to the emotions, and then you just kind of think, well, will this get better? And if you feel like it's not going to get better, that's where that helplessness and hopelessness sort of sets in, and some people can become quite depressed through that. So I feel that knowing that there is hope and you can heal the body, you can heal the mind, it really can help to revitalize, people in their spirit, right, and in their body. So it's really wonderful to have this information, and I'd love to talk more about the emotional aspect of back pain. And it was interesting. I was reading. Something with Louise Hay, and I love Louise Hay,
Love
motivational
Louise
author.
Hay.
Yes, and her
Mhm.
book Heal You Can Heal Your Body, right?
Yes.
And I always found it interesting. She talks about the connection between lack of support, whether that be emotional support or financial support, which can stimulate back pain. And as I think about it, I thought, okay, so I'm experiencing this back pain, and I thought, okay, well, part of it, could be associated to just some of the side effects of treatment. But then I also realized that, I actually was, quite stressed, overwhelmed, thinking, all right, I got to, get my business back up and running, and to not be working for several months due to physical illness, that obviously had an impact financially. So I thought, oh, maybe this is my body saying, okay, time to address this situation. So can we talk a little
Absolutely.
deeper about that emotional connection?
Absolutely. The emotional connection, like I always talk about, people think, people ask me, is it how I'm walking? Is it my purse? Is it how I'm driving? Is it what I'm lifting? And absolutely physical stressors and all of these things layer up.
Mm-hmm.
However, the emotional aspect of stress is the largest contributor to these nerve system blockages and overwhelming the system with
Mm-hmm.
stress. So we definitely need to look at our emotional state and healing, and coming up with strategies on how we can heal our thoughts, how we can think better, how we can do better, how we can get unstuck that way. But I want you to know, and I want people to know, people always think like, oh, I've done everything. Most of the people that come into see me, Tanya, have done, like, they've been to the specialists 5 times. You go to your MD, they send you to physio for 2, 3, 6 months, a year. People go 2, 3 times a week with not a lot of benefit. Well, I mean, they're not helping themselves, but they continue to go. Then they go to this specialist and that specialist. They come, and I'm oftentimes their last resort.
Mm-hmm.
So when I hear people say, I've done everything, some people have very little have actually done everything. So let's look at, like, chiropractic, such a low force, non-invasive way to check, is it an actual misalignment that's causing these imbalances? Can we take pressure? Can we create ease to the system? Can we remove the interference and restore the body's ability to heal itself, so that when we do, have a great diet, and when we do emotional clearings, when we eat well, our body can integrate those beautiful changes instead of just like doing one thing at a time. I don't know if clearing the emotions will take away the back pain. It might, if that's the
Mm-hmm.
only thing that's causing it, because it is the biggest culprit, biggest stressor. But we do need to look at other things and evaluate, how is our brain and nervous system integrating all this stuff, and can we help by doing some adjustments or spinal care, alleviate some of those stressors.
Yeah, I love that. I think it's really important to look at, the whole as opposed to just one thing, as you say, and addressing, all of those concerns. And we're going to talk a little bit more about what that process looks like when we come back after this break. So stay with us. We're going to be back here on the Mindset Mentor. I'm Tania Kolar, and my special guest today is Nancy Korenic, who is a chiropractic doctor and is helping us to get healthy and stay healthy. Stay tuned. Welcome back to the Mindset Mentor. I'm Tania Kolar, helping you cultivate and strengthen your mindset. Your mindset is equated to absolutely everything in your life. So when you shift your mindset, you absolutely shift your life. And today we're going to shift your health, and certainly maybe what you even think about health when it comes to back pain and skeletal health, and actually throughout the entire nervous system. My expert today is guest Nancy Korenic. She is a chiropractic doctor, and she is also the owner of Core Energy Chiropractic and Wellness Center, which is in Mississauga. helping people to really, reclaim their health and to stay healthy. I think it's one thing to address, one issue, but we want to understand and know how we can have that, health in the long term as well, and not just sort of a band-aid solution. So just before we took a break, Nancy, we were talking about, some of the process, right, of healing the body and the assessment. So let's talk about the assessment process when somebody comes in to your clinic to talk about or to understand some of the pain that they're experiencing. What does that look like? Where do they start?
When they come in to see me, we do a chiropractic assessment. So we basically assess whether they are in the right place at the right time. I don't want to waste people's time, energy, or money. I look and hear what their complaints are, because most people do come in with complaints. As I alluded to before, they're coming in with problems that they haven't been able to get taken care of elsewhere. So we just basically listen to what's going on in their life, and then I evaluate if this is a case that I can help. The biggest thing, Tanya, and it really fits in with your mindset, is I really a big thing that I focus on is giving people hope. Okay. Because a lot, and also changing their mindset into, because we live in a quick fix society. Okay. So people come in, and when they come in to see me, they just dump all their problems on me and expect to come see me once or twice or three times, and we're going to fix everything. And that's not the case. So I really have to be mindful about how I manage people's expectations and give them hope at the same time. Okay. Because people want that quick fix. So when we do an assessment, that entails an initial history where I go over what they've done, what's hurting, how long it's been there, how it was caused, was there a trigger, have they had this before? We go through the whole entire history. Then if we feel like it's a right fit, and if it's something that I can help with, we go on to the assessment, which includes first palpation. I feel their alignment of their spine. I lay them down usually. I also sit them up, and I'm feeling for motion in their back, in their spine, in their pelvis, in their neck. I'm feeling for joint motion. Okay. I'm looking at leg lengths, Tanya, because when they're lying down, your leg length, that gives us an idea of how balanced they are. We look at posture. We do an in-depth posture assessment, because when people have unleveling in their hips or shoulders or their head, they don't even notice it, So we do an in-depth posture assessment, because when things are off on the outside, they're definitely off and compromised on the inside. So we do pictures of the posture. Okay. We do bilateral weight scales, and we have people go on the scales with right foot on one, left foot on another. And we look at how are you distributing your weight? Okay. Ideally, it should be fairly equal, if not right, like equal. A lot of times people are carrying 10, even 20 pounds on more on one side than the other, So the wear and tear is not equal. And then we do, I have a technology, and it's called, it's a CLA technology. It's SEMG, where I'm actually measuring the stress on the nervous system, and we do scans. So the scan actually comes out. I wish I had a picture of it here, but it shows me how much stress is on the nervous system and how balanced it is. Okay. If there's stress on the nervous system, it shows up in color. So we're looking at patterns. We're looking at right side, left side, our muscles on the right and muscles on the left, because muscles are controlled by the brain, right? Muscles are workers. If they're getting the signal, the proper signal from the brain, they're getting the right message, whether to contract or whether to, get weak. So they need to be working the same on both sides of the muscle. So we do an SEMG, a neurological scan, to assess that. And then finally, we send for x-rays, if pertinent, to see what is the condition of the spine. Because Tanya, what a lot of people don't know is that the spinal bones degenerate just like the teeth decay. We brush our teeth every morning. We hopefully floss them at least once a day, and we're looking at our teeth. We can see them every day in the mirror. We don't know the condition of the spine unless we actually look at it, take pictures. The spine does degenerate. Okay. And it should degenerate as we age, but it will degenerate. Like I said, it can degenerate slowly and it should be equal and symmetrical. If there's pockets of degeneration or increased wear and tear, we will see that on x-ray. Okay. It'll give me an idea of how long this person has been accommodating this stressor, because the body and the structure will adapt and it'll create damage in the spine, and it can lead to detrimental effects on your life and your health. And you're right, when people aren't feeling well, when their structure is blocked and locked and they can't function properly, what do you think that does to their mental state? They don't want to get out of bed. They are depressed. They can't go to the bathroom normally. Okay. They get anxious. They can't breathe normally sometimes. So that leads, like the number of people in the last 2 years that I've seen with anxiety, depression, people are beside themselves, and there is pain too, but there's so much digestive stuff going on. And we all know, like, the gut is a huge, issue too. And a lot of people aren't even going to the bathroom, and when those toxins build up, they are leading to fatigue, depression, anxiety. Like, it's all connected. The gut is our second brain. So a lot of times, like what with chiropractic, a lot of times when we're balancing the pelvis, especially, that people come in and they're like, oh my God, I have been constipated for years and now I'm going regular. Like, it's actually beautiful and miraculous what we can do. And the spine is like a map.
Yeah, that's so fascinating, and to be able to release those toxic buildup that in the body, I think
Absolutely.
that's really key, because that, of course, leads to inflammation, and inflammation, as they say, leads to disease in the body, right?
Everything is inflammation. Yes.
Yeah.
Yes.
So when you are treating somebody, who has that sort of, misalignment, and that the blockages, how realistic is it to clear those blockages? Because I know that a lot of people, and I think this is part of the myth of what people think about chiropractors, is that, once you go in, to see a chiropractor, you're going to have to see a chiropractor for life. And, I know that you mentioned it's certainly not a quick fix, right? But,
Right.
is there a balance somewhere in there?
Absolutely. So I tell all my patients, I'm like, you can use it for crisis care.
Mm-hmm.
So we can adjust you until you look and feel the way you want to. Okay.
Mm-hmm.
So
Mm-hmm.
that could be 12 visits, 15 visits, a month to 3 months. Everybody's different. It depends what kind of canvas I'm working with, right?
Right,
If
right.
you've got somebody that's 30, 40, 50 years of age, there's a lot of deterioration. That person is not going to heal as fast as somebody else, maybe in their 20s. Okay.
Mm-hmm.
So you have choices. And I do hear that a lot. Once you go, you always have to go. And frankly, I tell people, I said, chiropractic is a lifestyle. It is not a treatment for pain or
Mm-hmm.
anything else in your life. It does create the balance. It removes stress. It improves function. It restores healing. So people normally they will choose to do it for life or not. Like, how long, when do you stop going to the gym? Why do people go to the gym? Like, as soon as you stop going to the gym, if you do work out, when is a good time to stop? Like, when you look and feel the way you want, is it a good time to stop? Because guess what? That stuff is going to build up on you and you're going to start to lose some of those benefits that you gained. We are living beings. Things are always changing. Nothing ever stays the same, Tanya. So
Mm-hmm.
maintenance in my world, anything you don't maintain will start to deteriorate and dysfunction. Now, my patients are always the boss, and they get to choose. It's like, if you want to do this until your pain is gone, your crisis is gone, and use me like an expensive Advil, because it will add up, that's your choice. But those people, and they love the freedom of that. I don't want people to tell me what to do forever.
Mm-hmm.
Everybody has their own goals, and I meet people where they're at. And if they want to just, if they want to correct the problem and they want to maintain their body and they see the value in living with a balanced structure and a great functioning nervous system, then they will stay on. Like, I've had people that have been with me for 20 years and they come in monthly or even quarterly.
Mm-hmm.
But then I
Mm-hmm.
have people that just come in just for pain, and they'll come in for a couple of visits. As soon as they're happy with how they feel, they're gone, but they will call me back when that pain comes back, because it will come back eventually. So
Yeah,
I hope that answers your question.
yeah, yeah, absolutely. I love that. Just think about, our cars, right? They, need a good tune-up every so often, right? To stay in optimal shape and to, keep running smoothly. And I think it is important to, take charge of our health. And first it starts with the willingness to help ourselves, the willingness to get better, to feel better. And everybody
100%.
deserves that. So if you're listening right now and you are finding it really difficult to navigate your day because of your health challenges, I encourage you to reach out, seek the professionals who can help you. And by the way, you always want to consult your doctor, first, but you definitely want to consider some alternative, therapies like chiropractic care. And I was one of those people that I truly didn't understand what chiropractic care was. I'm talking, many years ago. But I'm always very curious and I'm always willing to try. And I remember after the first chiropractic visit that I had an immense improvement in my body. And I thought, wow, this is amazing. And I kind of had that fear because, I watched some of those videos, that you see on YouTube out there of the cracking of the back. And you're like, oh my gosh, this is so awful. It sounds awful. But then to go through the process, it's wonderful. And also those videos are extreme. So that's not your typical sort of,
There are
yeah.
some extreme videos out there. And believe
Yeah.
it or not, I mean,
Mm-hmm.
I've had more requests for people coming in, watching these videos, and they're like, are you going to crack my back? Are you going to crack my neck? I'm like, wow, never in 20 years have I heard that so much as I've heard it now. So,
Wow.
and to that point, um, there's over 100 different ways to adjust the spine.
Mm-hmm.
Manually adjusting, what you would refer as cracking, where
Mm-hmm.
you hear that cavitation, you hear that release, is one way. So there's many different, I use 12, I'm trained in 12 different techniques. I tell
Mm-hmm.
people, I'm like, you'll never know when I'm switching, but I'm always working within that comfort level. So there's a lot of people that don't want to be cracked. And then there's those that really want to be cracked. So
Yeah.
to have all those tools and the ability to be able to work with all of those people. I mean, I work with babies and pregnant moms too, so you're not cracking any of that. Even my elderly grandmother, I actually learned, a special technique where it's so non-invasive. It's light touch, and you're working with the nervous system instead of, like, when you're moving the bones and that cavitation, you're moving the structure. That's
Mm.
to affect and stimulate the nervous system. But what about if you actually stimulate the nervous system, you go directly, you bypass that? And it's such a beautiful, gentle, energetic way to balance the tone of the nervous system. So there's many, many different ways. And people don't need to be afraid of the chiropractic manual adjustment, but that is one of the techniques.
I love that. So I want to talk a little bit more about some specific examples and some of the results that you've seen with your patients. But I think it's good to take a break right now, and then we'll pick up the conversation when we come back. You're listening to The Mindset Mentor. I'm Tania Kolar, and we will be back here on Sauga 960 AM with Nancy Korenic, who is a doctor of chiropractic, and she is also the owner of Core Energy Chiropractic and Wellness Center, helping us to get healthy and stay healthy. Stay with us. Well, hello and welcome back to The Mindset Mentor. I'm Tania Kolar. You're listening to Sauga 960 AM. And today we're focusing on chiropractic care and, overall, health of the body, and also the connection between mind and body and the physiological aspects, that happen. So whether you're experiencing chronic or acute pain, I think we've all been there at some point. And unfortunately, many people are experiencing that pain to a point where it becomes very difficult to do daily things, simple things that many of us would feel are simple and ordinary, like brushing your teeth, getting out of bed. These things can become really challenging when you are experiencing a lot of pain. So we're going to really focus on getting healthy, and staying healthy is the goal. We all want to live our best life, and certainly it's challenging to live your best life when you're not feeling good, when your body is just not cooperating or your mind is not not cooperating with you. So my guest today is Nancy Korenic. She is a doctor of chiropractic. And, Nancy, let's delve into some of the patients that you've seen. What were some of their ailments coming in, and how were you able to help them, and what was the result?
Okay, so you know what, Tanya, normally a lot like people come in with some sort of complaint, whether it's
Mm,
neck pain, whether it's headaches, whether it's shoulder problems, whether
mm-hmm,
it's, low back pain. Everybody's different, even sciatica. Um, so, and when I see them, when we're doing the assessment, is when we actually see where the blockages exist. They actually innervate different parts of the body. So, if, for example, low back, the nerves that come out of the low back actually go to your reproductive system, and they actually go to the leg function, right? So, when people have a problem in that pelvic area or in the lower lumbar area, I always question, because a lot of people don't want to tell me, but I'm always like, do you have bowel issues? Do you have issues going to the bathroom? Do you have constipation, diarrhea, IBS, that type of stuff?
mm-hmm.
Or even reproductive issues. There's a lot of people that, haven't been able to have children, or haven't been able to get pregnant, or can, have the pregnancy, or follow through with the pregnancy that perhaps. So, these are some of the things that we're dealing with. And a lot of times, I mean, I'm not going to sit here and tell you, oh my gosh, they're pregnant within 5 adjustments.
Mm-hmm.
No, but a lot of times that creates a lot of anxiety. So when we get this flowing, the pelvic region flowing, the patients are able to carry, carried throughout the pregnancy. One woman actually came in to see me after she had a C-section, emergency C-section, the first baby, and she was so disappointed, with having to do it that way. And then we actually started adjusting her. She came to see me with her second pregnancy. We had just started adjusting her, and she was actually able to have a vaginal birth, which, is not as it's not as common, right? Like once you have a C-section, you're kind of put into that bucket, and you have to continue having those. So she's had 5 kids. So
Wow.
after, which in total,
Yeah.
so her C-section was the first one, but every
Mm-hmm.
single time she comes in to see me, and then she's able to have the actual vaginal birth, which is really, really happy, which she's really happy with. So that's kind of on one end. And then there's people like big muscle head guys that come in, and they come in with a shoulder injury. And, after 12 adjustments or 15 adjustments, we'll do the rescan. And you make connections with these people, and you see patterns. And
Mm-hmm.
I didn't even pick up any anxiety or depression within this person, because he seemed like, he's working, he's energetic, he's got a shoulder injury, he's having problems at the gym. We helped
Yep.
him through that. But then these big burly guys are like, oh my God, Nancy, he says, you have no idea, but I was contemplating suicide before we came in to see you,
Oh,
and then they
wow.
reveal stuff like that. And it just like, it barrels me over, because you never know what somebody's dealing with, even elderly, like parents of, that are kind of in that middle age or latter stages of life in their 60s, where they're taking care of their loved ones, their parents who are aging, and yet they have kids and grandchildren. And they're caught in between this, because they can't do what they used to do functionally, and there's a lot of pressure on them, and they can't sleep. A lot of people have problems sleeping, which then downward spiral, and it gives them anxiety and depression. And then it feeds into that negative spiral. So, I mean, bringing life and bringing, restoring the connections within these people it's so beautiful to see these people light up, because these people, especially those people in their 60s, they've been taking all the medication. They've been living on the medication, and they didn't feel like there was any hope. So when you see their lights go on, and then they can do more for not only their kids and their grandkids, but then they can do more for their aging parents, it makes my heart sing. It's such a beautiful, it's so fulfilling, to be turning on life and empowering people and giving them the hope that they need, so that they can get off those medications. Some of them don't. Some of them stay on medications, but I've never seen a case where medication whether it's for anxiety, depression, even diabetes,
Mm-hmm.
is reduced. You know, when the body is functioning better, when you're making those connections and when the body can actually heal itself and work the way it's designed to, there's no limits to what can happen. They don't always do, but we wait. And I always love and appreciate seeing those miracles.
Oh, that's so beautifully said. Yes, because miracles happen every day, and I think it's so important to let everyone know who is listening and who's watching that there is always hope. So please never give up. Never give up on yourself.
Right.
Never give up on your loved ones who are experiencing that challenge. There are ways that we can help ourselves, and of course, so many people are experiencing a decline in health for varying reasons and to certainly different degrees, but there is always help. And we encourage you to, have that willingness, right, to seek out some alternative therapies.
Yes.
Do what you can,
Yes.
reach out to people who can help. And sometimes it's a simply matter of reaching out and letting, family and friends know how you're feeling. You spoke about the gentleman that came in and you had no idea that he was contemplating suicide. And, I think it's so important to reach out to friends and family and just, ask them if they're okay. Because it's, we all get sidelined and, in our lives and we're busy and we're overwhelmed ourselves. And sometimes we forget to, just check in. And for the people who appear like they've got it all together, oftentimes there's a lot going on the inside that we can't see. But certainly that person is feeling those effects and it manifests in the body. Feelings and emotions that we don't process get suppressed, and those get trapped in the body, and those traps, lead to again that inflammation and that physical pain. So when you're assessing, any of your patients, to come in, how do you determine, that there's what you call interferences? How do we know, and how can we gauge listening right now to know that we actually have an interference somewhere in the nervous system?
So interesting question because there's really no way of knowing unless you get checked.
Mm-hmm.
So I
Mm-hmm.
don't even know, when I have an interference because sometimes I'll
Ah,
go in and I'll be like, oh, I have a right C2, and
yep.
then the doc is like, no, because that's the end result. That's the symptom.
Right.
So that is being caused by an interference somewhere else, perhaps in the spine. And sometimes I go in expecting an adjustment, hoping for an adjustment. And they're like, no, you're clear. I'm like, oh my God, no, I can't be clear. Again, because
Yeah.
it's all about just, it's some of the symptoms, like it's like eating something bad. If we eat bad food or bad fish and we're vomiting, that's a perfect response. That's
Mm-hmm.
a healthy response. We're not sick. Our body's doing what it needs to do in order to get rid of the toxins, the bad food that we just had.
Mm-hmm.
So pain, or when we think we need an adjustment, or when we think we have nerve interference, is actually like the body's working the way it's supposed to be working. So it doesn't, to answer your question, we don't really know until we get checked.
Got
So
it.
that's why it's important to get checked on a regular basis.
Yeah, it sounds great. And so you had mentioned earlier that you have treated pregnant ladies and babies. So I'm imagining that there really is no sort of age restriction. Okay, so that's actually fantastic and good to know. You also mentioned just a moment ago about, you gave an example of eating bad food. But while we're on that topic of food, can our diet be a factor in some of the pains that we're experiencing?
100%. So, food is not what it used to be. We all
Mm-hmm.
know that, right? So that is a chemical stressor. So whatever they're putting in the food, I mean, and a lot of it's lacking in nutrients.
Mm-hmm.
So our body's actually starving, and that's a chemical stress, right? The air that we breathe, the water that we drink, the food that we eat, if it's chemicals, if it's GMO, if it's pesticide, that's a whole nother topic. But absolutely, if we're not getting the nourishment, if we're not fueling the body the way we need to, it creates a chemical stressor in the system, and it creates a negative effect and can interfere with the nervous system's proper function.
Yeah, I love that. So do you have any tips on, some foods that would be helpful if we're not in optimal health right now? As a general, is there a guideline?
A general is like eating lots of fruits and vegetables.
Yep.
eating lots of colorful plates,
Mm-hmm.
lots of colorful fruits and vegetables. A big thing with me and inflammation, obviously I deal with a lot of people with inflammation,
Mm-hmm.
is removing dairy, and all sugar,
Mm-hmm.
and grains. We get to that point, which is really, really hard because when you're eating diets like that, it adds to the inflammation. It feeds the inflammation. So that's one of the things. If we need to go down that route, I don't do that with everybody. But if we need to make some progress with people in that diet, specific areas, different things, I will get them to remove all dairy, eliminate all dairy, all sugar, and even gluten products like, grains, that type of stuff.
Yeah, so I know a lot of people, certainly have either food allergies or food
That's,
sensitivities, and
yeah,
a lot of the things that you just mentioned are certainly related to that. Those could be
yes,
some of the culprits, and it's amazing the transformation that can happen when you start to
absolutely.
eliminate, right, some of those foods that you may not have even realized are actually, aggressors in that poor health, right? So it's the
Especially with
simple things.
mental
Mm-hmm.
health
Mm-hmm.
too. When we start to eliminate those triggers or those stressors, you see people's focus come back. You see their brain fog disappear. You
Yeah.
see their mental state. They get less depressed. They can be at more peace and feel more joy. So our gut is really our second brain. And feeding it and nourishing it will absolutely get you into a better mental state where you can make better decisions.
Yes, and the mindset is certainly key in those regards. So I think that what happens sometimes is that when we say that we're not going to have this, we're never going to eat this food again, you want to get healthy and you have the best intention, right, of doing that. But then like day 5, you're like, I can't do this anymore. I give up, and then you want to have all those things. I think we need to really focus the mindset to know that, okay, so maybe it's easier for you to say for 30 days, I'm going to do this, and then see how you feel. I did that actually once when I gave up alcohol. And I still have days where I'll have alcohol. I do love a good glass of red wine. But so I did this where I was like, okay, I think it's impossible. I thought it was impossible to give it up, and I thought, okay, I'm going to do 30 days, and I found it actually so much easier than I thought. Now, actually giving it up for 30 days was much easier than the thought of giving it up, right?
Right.
And once I made that decision, I was like, oh, this is actually kind of easy. So I got to 30 days. And then I said, hey, that was pretty easy. I'm going to do another 30 days. I did it again, and I did it again, and I did it again. So I did it for 6 months. And I felt amazing. And
Yeah.
I was able to do that because I broke it down into more manageable chunks. And I think that, right, if you can just, focus on even for like one day, if today I can stop eating carbs or the dairy or whatever food is that you want to give up, make it through the 24 days. Anyone
Yeah.
can do anything for 24 hours, right? So if you can make it through that, and then you reward yourself, give yourself a pat on the back for achieving your goal. And that actually creates that dopamine hit in the brain, right? Where it's like that's the reward center. We want that dopamine, and when we have more dopamine, it's easier to stick with those goals, right? Because we
Absolutely.
understand that pleasure.
And I think, to add to your point, I think a big thing is to not, like, if you do, cheat or fall off,
Mm-hmm.
if you don't do it perfectly, a lot of people will beat themselves up.
Yeah.
And that is not good for anybody. I always say to people, I'm like, just you correct and continue. You be gentle with yourself and you correct and continue. Because a lot of people will just be paralyzed by that and just
Yeah.
stop. And then they'll be like, oh my God, I can't do it. No, 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 no. Everybody, you just correct and continue, So don't beat yourself up. Just get back on that. It's not how many times we fall down, it's how many times we get back up, right? So I think that's
Yes.
a really important point. And I love how you structured it where, I tell people a month too, like
Mm-hmm.
eliminate it for a month. Start with a month and see how you feel. It's not going to be forever. You may choose it forever once you
Yes.
feel that, but
Mm-hmm.
you're not doing anything. Nothing is written in stone. You're just doing it right now in order. Let's see what we can get. Like, let's see what kind of results it will provide you with. So
Yeah, and oftentimes the way that you feel as you're eliminating, the food, or the beverage, whatever it is that you're eliminating, when you start to feel better, I mean that's motivation right there. You're like, hey, I like this feeling.
absolutely,
I like feeling like this. So you want to continue that, and remember,
absolutely.
right, that there is always hope. And unfortunately, we're out of time. So I want to ask Nancy to let the listeners know how they can find you.
So you can find me at www.korenergy.ca. That's KOREENERGY.ca. I'm in Mississauga. I'd love to help if I can. So you can reach out to me, or just come and see me and we can do a consult. Love to see you.
I love that. All right. So remember, that's Core Energy with a K to coincide
Yes.
with Nancy's last name, Korenic.
Yes. Yes.
Awesome.
Got that.
Well, yes, Nancy, it's been an absolute pleasure having you here, and thank you for helping us to get healthy. And certainly the goal is to stay healthy and to live an authentic life. So I thank you for your mission and your passion for helping to, encourage people to take, action and to get their life on track and to stay healthy and authentic.
Thank you so much. It's been so much fun.
All right, everyone. So that is your mindset workout for today. So make sure that you really remain hopeful. I know life has been certainly very challenging for so many people, in the past, couple of years, particularly. And, I want you to always remember that life is a cycle. So when we are in those down cycles, there will be a shift and you will get out of what feels like perpetual darkness, sometimes hopelessness, but you will shift and you will move from that. It may take a little bit of time, but you can get there and you will get there. I promise you. So remember, life is that cycle, and I want you to live your best life. Stay tuned for more here on Sauga 960 AM, and I look forward to you joining me next Thursday at 3 p.m. for The Mindset Mentor.